I can't begin to tell you how horrified I am at this outbreak of coronavirus. I really believe that if China had been more transparent early on and shared information earlier, we would not be where we are today. But it is what it is. And you know that I never make a video unless I have something positive to share with you. For instance, today I'm going to talk about a computer that's searching for drugs for us, and also a paper that dropped just a few days ago that talks about a clinical trial of new drugs that can be used to treat the coronavirus. Right now we are inundated with information, to social distance, to work from home, to wash our hands, and it seems this is almost the stuff of science fiction. But these activities, or these lack of activities, will work for us. But I see people that just can't seem to believe it. And every day on my groups, I see that people are talking about kids that are playing basketball in groups, or other people having friends over their homes that in larger groups perhaps than they should. The thing is with this is it's not going to discriminate. The grandchild you love, your best friend, your neighbor who you really like to spend time with, they all can give you coronavirus. So please, social distance, stay home if you can. It will save a life. Now, let's get on to the paper I want to talk about. The title of the paper, let's put that title up here, and it is Hydroxychloroquine and azithromycin as a treatment for COVID-19, results of an open-label, non-randomized clinical trial. Now, let's take a look at the basis of this paper. It was based on the following. This paper reported that an inhibitor effect of remdesivir, a new antiviral drug, and chloroquine, an old anti-malarial drug, on the growth of SARS-CoV-2 in vitro. And an early clinical trial conducted in COVID-19 Chinese patients showed that chloroquine had a significant effect both in terms of clinical outcome and viral clearance when comparing to the controls. Chinese experts recommend that patients diagnosed as mild, moderate, and severe cases of COVID-19 pneumonia and without contraindications to chloroquine be treated with 500 milligrams of chloroquine twice a day for 10 days. Okay, let's take a look at what this paper actually did. This paper enrolled a small group of individuals and found that yes, treatment with hydroxychloroquine and azithromycin did lower or eradicate COVID-19 viral load. And let's put up the results. 6 patients who were asymptomatic, 22 had upper respiratory tract infections, and 8 had lower respiratory tract infections, and 20 cases were treated in this study and showed a significant reduction of viral carriage at day 6 post-inclusion compared to the controls, and much lower average carrying during the duration than reported of untreated patients in the literature. Azithromycin added to the hydroxychloroquine was significantly more efficient for virus elimination. So the results for this small study were positive. Let's take a look at what the authors concluded. Despite its small sample size, our survey shows that hydroxychloroquine treatment is significantly associated with viral load reduction disappearance in COVID-19 patients, and its effect is reinforced by azithromycin. So the beauty of this is that these are drugs that have been through clinical trials. They're approved, and they can use them in what they call off-label use. Let's talk for a minute about Summit. Summit is a supercomputer at the Oak Ridge National Laboratories. And what they're doing is they're allowing this supercomputer to rapidly comb through the massive amount of medical information that's out there in all of the published journals and various libraries that it can access. And the good news is, as of this morning, it found 77 candidates for COVID-19 treatment that are existing drugs that have been through clinical trials, which means they can be fast-tracked for use. Let's take a look at the chloroquine for a minute. The chloroquine is a zinc ionophore, and as a zinc ionophore, it allows higher amounts of zinc into the cell than normal. And this is fairly non-toxic for us, but the replicating enzyme that COVID-19 uses is inhibited by zinc. So if you get high levels of zinc in the cell, that is how it eliminates the viral load because the virus can't replicate. So there is much hope on the horizon. I live about 50 miles out of New York City, which is right in the epicenter of this whole outbreak. And yet every day I see people doing things that are against the recommendations of our healthcare agencies and government. So I really recommend that you do try to follow the different recommendations such as washing your hands, social distancing, and so forth. Until next time, this is Judy Chalice with Lifespan and Longevity. Stay home, save a life.